Lung cancer, an interplay between behavioral and psychosocial factors with early clinical markers. Lung cancer is the most frequent cause of cancer deaths. Popularity came from World War II, where soldiers being drafted were buying tobacco. It has very low recovery rates. My literature review is broken into behavioral risk factors. Cancer patients are typically between 40 to 80 years of age. 70% of them are obese. 88% of the women who have cancer are smokers, and 57% are men are smokers. In the psychological burden, 25% of cancer patients suffer stigma from being abandoned from their family, friends. My goal in this research is to be able to address these two hypotheses. The null hypothesis being there's no significant interaction, and the impact of psychological and behavioral habits on lung cancer is the sum of their independent events, and there's no integration that exists. My alternative is there's actually a significant interaction, and I would also be checking if it's moderated by age and gender. My data set was gotten from Cargo. It had 309 after data cleaning and pruning. It became 276. It has about 16 key features. The only continuous variable is age. The others are categorical variables. Looking at lung cancer, for instance, about 238 have lung cancer and 38 don't have lung cancer. I saw between behavioral key factors and lung cancer, behavioral like smoking and alcohol, 96.2% that smoke and drink alcohol have lung cancer, and 96% from the psychosocial part with anxiety and peer pressure, have lung cancer. I also carried out Pearson's correlation to look at the relationship with lung cancer from a whole to get the top positive. There were no negative ones. And I broke it down further to look at between the key focus areas and lung cancer. And I saw that peer pressure from the psychosocial bit, was a top positive, and from the behavioral bit, alcohol consumption was a top positive. Moderators, age and gender, they were not very strong and positive. Then for my results, I fitted three models. The base model, the full model having age being there. So carrying out inferential statistics, I firstly started with logistic regression to predict, and I saw it had an accuracy of 86%. Carrying out likelihood tests, I saw the interaction using chi-square. Interaction versus base had 13.2, and interaction itself was about 11. Versus the full interaction versus full was 11.05, showing the interaction taking a lead. Then doing a Wells test to confirm what are the key outliers, I saw alcohol consuming was a major moderator, alcohol and anxiety together, and peer pressure. Looking at evidence interval, I saw I was also able to identify them, and I saw alcohol consumption is about 65% times more likely. Pressure about 4.4%, and anxiety moderates alcohol. So anxiety actually goes in the other direction, which is why anxiety is the moderator to alcohol. Then carrying out another test, I saw that firstly, before I was able to do that, I had to ensure that the distance between the data in the models were not too spread out. So I used k-means so I can bin it, and I used bin data to three categories. I saw gender wasn't significant, and comparing smoking with alcohol, I saw that alcohol is a strong indicator, or an alcohol with smoking, but smoking wasn't really a strong indicator, which was quite interesting. I'm carrying out Bayesian statistics. It had an accuracy of 87%. Using the WAIC test, the WAIC test was a bit inconclusive. So I had to use the LOO test, and I saw the LOO test correlated what we had for interaction. The interaction model was the best model. Approximate base factor, it was quite interesting because the interaction versus the base, was clear that interaction was leading, but full versus interaction was inconclusive. The data was ridiculously high. So I suspect either full doesn't pay as much influence as I would have thought. Carrying out credible interval, I saw the top two were alcohol consumption and peer pressure. So in conclusion, the analysis rejects the null hypothesis, and psychosocial and behavioral factors do in fact influence lung cancer. Thank you. If you would like to get the code, it's accessible via the repo link. Thank you very much.